Welcome back. My next guests are from KORT Physical Therapy. They are physical therapists, Miss Amy Thurman and Caitlin Ackerman.
Yes.
Welcome.
Thank you. Thank you.
Now, I started this show with bladder control issues and pelvic dysfunction. So tell me, what is pelvic dysfunction?
Pelvic dysfunction can take many forms. Most notably, people who have problems with incontinence, where they can't hold their urine, whether it be in a stress incontinence situation, if you cough or sneeze or laugh and you leak a little bit, or if it's an urge incontinence where you feel like you're running to the bathroom several times a day, or that you can't fully empty your bladder. Those are probably the two most common things that we see patients for. It could also be issues with muscle tone, where they can't relax the muscles enough and then they have pain associated with that.
Okay.
So.
Who's a typical patient that you might see?
We see a broad range, really, male and female. Female patients, we see a lot of postpartum patients, so new moms that are having trouble controlling their bladder, having trouble really focusing on those pelvic floor muscles. It's a lot of education to really tune them in to what they need to work on. We can see elderly women with prolapse issues. So again, that's more of a strength and control issue. And then we see men, most commonly, we see them after they've had like a prostatectomy that need bladder control and strengthening for that reason.
Well, there's obviously medications and even surgical procedures, but you all work more towards the physical therapy end of things.
Correct. Absolutely.
And it's also can affect bowel function also.
Yes. So if there's dysfunction, people can have issues with holding their bowels or incontinence. So if there's lots of tone in the muscles where they just can't relax enough to make that happen, or they have poor postures on the toilet, which sounds kind of funny, but a lot of our education is for toileting postures, because just the way the muscles are oriented, sometimes we're doing it all wrong, and that causes more problems.
Well, and that's part of the treatment is the education part.
Yes, exactly. That's probably the biggest piece that differentiates us and our physical therapy specialty from just a regular physical therapist. We've had extensive training on those muscles and how to really engage those muscles properly. Most men and women who go to do a Kegel probably aren't doing it correctly. So it's education, and it's strengthening those muscles and our cues to kind of get them to work on those muscles correctly.
Now, Kegel is an exercise.
It's an exercise.
And that's one of the things you teach.
Yes. Common misconception with that is that everybody should do Kegels. Unfortunately, that's not true. Some people who have too much tone in the muscles and can't relax those muscles probably should learn how to relax those as well as contract properly. So that's part of, the education and the conversation we have with that patient who's having whatever dysfunction. Is it's not always about just doing that particular movement. We want to be an adjunct to, medical treatments, the medication, surgeries, but it's that educational piece that's not always exactly what you need to do. So
Now, there's also exercises, but there's biofeedback.
Yes, so that's a big piece of what we do. We use surface EMG most of the time, so those are just electrodes that we place on the pelvic floor musculature, and then with our training and cueing and exercises to really engage those muscles, it gives the patients that direct feedback if they're using that muscle correctly. So that's probably one of the biggest tools that we use with each patient.
It's kind of like using your smartwatch to make sure you're walking enough steps. The feedback tells you if you're using the right muscles.
yeah, yes.
Yeah.
Now, the other side of relaxed muscles are tight muscles and pelvic pain. You treat that also.
Absolutely, yes. Similar to any other chronic muscular condition, people have stress headaches. They usually have a lot of tension in their shoulders or their neck. It's very similar to that. The muscle tone can be so much that you get little trigger points in the area, and we are trained to help patients relieve those with hands-on manual interventions, as well as that biofeedback for down training, more so than learning how to contract.
Instead of contract, relax, just the opposite.
Exactly.
Now, this is a pretty specialized area, and there's not a lot of people, especially in Central Kentucky, who focus on pelvic dysfunction. You guys have several areas where people can access.
Yes.
We do, yes. Amy is in Richmond. I'm in Frankfurt part of the time. Just recently, I've started coming to the Bryan Station Clinic. We also have, because of the need for this, we've really grown into Fayette County. So we've got a clinician trained in the Beaumont location, the Eagle Creek location, Brandon Crossing, and then
Bryan
Bryan
Station.
Station where I am. Yeah.
Yes.
Both for
That's
men
me.
and women.
Yes.
Yeah.
It's great information.
Yes.
Thanks for coming in. We appreciate it.
Thanks.
Thanks for having us.